The gallbladder is a small organ that sits underneath the liver, and it stores bile that the liver produces. This bile helps with digesting different types of foods in the intestine. The gallbladder can get inflamed or blocked by stones is the most common reason, and this can result in a lot of pain or an infection of the gallbladder. Once we find out that the symptoms are related to the gallbladder from their history and their exam, then the best treatment is surgery, is just actually removing the entire gallbladder. My name is Yasser Akmal. I'm a staff physician in the Digestive Disease Institute here at Cleveland Clinic, Abu Dhabi. I'm part of a team of general surgeons and gastroenterologists here. The gallbladder is an important organ when it's there. However, when it's removed, the body compensates and you still get the production of bile and it still helps with the digestion. So in the long run, most people don't even notice that they don't have a gallbladder. Nowadays, the main technique for removing the gallbladder is we do it in a minimally invasive fashion. The minimally invasive technique is better than the open technique because there's a much quicker recovery. Most people have less pain, they get back to their normal work faster, and you have less scarring inside and outside the body. We usually do gallbladder surgery under general anesthesia, and the surgery usually takes about an hour or less. We place port into the abdomen and inflate the abdomen with gas. We place 3 additional ports into the abdomen and use a camera and a scope to look around inside. We then use long instruments to grasp the gallbladder, and we are able to dissect it out and cut the main artery and duct that go to the gallbladder. We place the gallbladder in a bag and we withdraw it from the body. We then release the gas from the body. We close the skin incisions and awake the patient from anesthesia. The recovery period is fairly quick. Most people who have the surgery will either go home the same day or by the next day after surgery. By about 1 to 2 months, most of the symptoms are completely gone. The main things we tell people to avoid after surgery is heavy lifting and also kind of swimming or submerging the incisions underwater. Other than that, while they're taking pain medications, we also tell them not to drive. After surgery, most people are able to eat pretty much what they want. They can go back onto a regular diet. We do tell people to try to have a well-balanced diet and still try to avoid a lot of fatty foods just for the general health. But a lot of people will find that they're able to eat things that they weren't able to eat before surgery now that the gallbladder is removed. This is a very, very common operation. It's one of the most common operations we do in general surgery. So the results are also very, very good. So we try to reassure the patients by telling them this and making it very clear to them how they're going to feel right after surgery and how quickly their recovery will be.